Hi, Adanma. My name is Yvette. I'm a physician here at Eve's Clinic, and I will be the doctor attending to you today. I don't think we've met before. I'm just going to ask you a few questions, and this should take about 5 to 10 minutes. Tell me why you're here today.
Hi, Doc. Recently, there's been some changes in my body that's been alarming me. I've been gaining weight recently in my upper body only, but my arms and legs look so thin. I've also developed some sort of hump on the back of my neck. My face has become extremely rounded and swollen, and it's just not my rapid physical change. I've also been feeling mentally drained and depressed all of a sudden. At times, I feel suddenly weak and tired, and would often have to go down and rest.
Okay, when did this weight gain start?
Honestly, I can't put a specific time frame on this because I've been noticing these changes for a while, but just chalk it up to just simple weight gain. But just recently it got worse, so I figured there was something wrong with me.
Have you had any changes in your diet recently?
No, I've been eating the same for years.
I noticed there are many visible bruises on your arms and legs. Have you had any difficulty moving around or been falling frequently?
No, I haven't been falling lately. In fact, I've been moving more carefully than ever these days. The only thing is, I've been experiencing some muscle weakness, but I just summed it up to my body not being able to handle the found weight gain.
Okay. Have you been prescribed or taken any medications to increase the amount of cortisol in your body?
No.
Okay, now I'm just gonna take your vital signs.
Okay.
Okay, your height is 5'7" and your weight is 230 pounds, which means you are classified as obese. You have a heart rate of 87 BPM and an oxygen saturation percent of 89. Your blood pressure is 146 over 92, which means you do have hypertension. Based on your symptoms, I do suspect that you may have Cushing syndrome. Because you mentioned that you do not take any cortisol increasing medications, we can rule that out as a cause. I'm going to order an MRI so we can screen for pituitary tumors and a urine test to check cortisol levels. Is that okay with you?
Yes, if it can help diagnose anything.
It definitely can, and we will have a follow up appointment in 2 days after your MRI and urine test results come out. You can go to the lab on the first floor, and that is where they will do your MRI and urine test. Thank you for coming to Eve's Clinic today.
Thanks, Doc.
Hi, Adama. It's good to see you again. This is your follow up appointment today, and I'm just going to discuss the results of your MRI scan and urine test done on Monday.
Okay.
So the urine test did show that there were increased levels of cortisol in your body, and the MRI did show that you had a pituitary tumor. The tumor is non-cancerous, but as a result, your pituitary gland is releasing too much adrenocorticotropic hormone, or ACTH. This is causing your adrenal glands to overproduce cortisol. I'm diagnosing you with Cushing syndrome based on your signs and symptoms as well as your test results. The next plan of action is to have your pituitary tumor surgically removed completely. This will help treat your Cushing syndrome. I'm referring you to Dr. Naomi Parker, a neurosurgeon at Perry Hall Neurosurgery. Please go to the front desk near the entrance and collect your referral papers. Thank you for coming to Eve's Clinic today.
Thanks, Doc.